The recent surge in detected cases of COVID-19 has resulted in more tests being taken. To help handle the larger workload, one COVID-19 testing lab has implemented automation. Since August, Pathnova Laboratories Lab at the NTU Lee Kong Chian School of Medicine's Novena campus has been using a robotic arm to help prepare samples for polymerase chain reaction tests. This enables the delivery of test results for clinically urgent swabs in 3 hours, compared to the usual 24 to 72-hour turnaround for a PCR test.
We use a new direct PCR method that is faster and reduces the need for some reagents, and this is important if there's supply chain shortages. We use big data. We collect data on 60 or more parameters for every sample that is brought into the lab. And this allows us to trace the quality, to predict problems before they occur, as well as to improve our lab workflows.
Many of the technological aspects are invisible to, the outsider, but there are also many parts that are visible. And for example, we do use a lot of robotics, and robotics are very helpful for automating and making things more efficient.
We do in-house programming so that they can be adapted for last-minute changes of protocols. We've got them voice-activated so that this allows hands-free operation, essential when one is in full PPE, and improves lab safety.
Working in close proximity to samples that could contain the virus is an unsettling thought for many. For Pathnova's staff, however, support from their friends and family has been unwavering as they do their part in Singapore's fight against COVID.
I think it's a national service that we provide the testing results as soon as possible for both the foreign workers and the migrant workers that are with us here in Singapore, for us to be able to provide the results as soon as possible and speeding up the results just more recently. I think that gives me a bit of satisfaction to know that people can either leave their quarantine or go see their family members.
My parents and my friends have been pretty supportive about what I am doing, but they are worried, I guess, in some sense, but they know that when I come to work, I take proper precautions. The first reactions were, of course, worried because we didn't know anything much about the virus back then in 2020. But as time passed, they were very supportive of my efforts here working in this lab because they know that I'm contributing to the national effort. They've also been asking me whether I'm okay with all this direct dealing with the samples itself. But I tell them as long as I'm taking proper precautions, everything will be fine.
The lab follows rather strict rules, external regulations on lab safety. So it ranges from the infrastructure of the lab, the airflow, to personal PPE that we have to don on, to actually the lab processes, the training. And so the lab is a fairly safe place to be.
Even with the lab's rigorous protocols in place to safeguard against infection, it doesn't hurt to take further precautions.
Last year, we actually, me and my wife got married. At the time, my wife volunteered in the red zone to help the foreign workers. So because she was working in the red zone and I was working in a COVID lab, we were both with direct contact with the virus. So we did move out just to protect the family members around us. Yeah.